commonest cause of non-cardiogenic pulmonary edema is ARDS, acute respiratory distress syndrome. Please, this one, the commonest cause, common things are common. Commonest cause of non-cardiogenic pulmonary edema is ARDS. Now, after we've done that, then we can look at the less common causes of non-cardiogenic pulmonary edema. So if you've not picked up the commonest cause, forget about the non-common causes. So first, even if you forget anything I'm teaching today, remember ARDS is the commonest cause of acute respiratory distress syndrome. What are the less common causes of non-cardiogenic pulmonary edema? Number one, neurogenic pulmonary edema. And what is neurogenic pulmonary edema? You have a patient who has head injury. After the head injury, the patient, you listen to the lungs, there's crackles. That is neurogenic pulmonary edema. You also have a patient who had a seizure. Just after the seizure, the patient develops bad pulmonary edema. That is what you call neurogenic pulmonary edema. Another one is a patient who has an intracranial bleed. And after the intracranial bleed, you listen to the lung, you realize that there's pulmonary edema all over. That is neurogenic pulmonary edema. Usually, neurogenic pulmonary edema, it is rapid in onset, and you see the infiltrates bilaterally. There is no cardiac failure. There's no heart failure in neurogenic pulmonary edema. The next one is high altitude pulmonary edema, HAPE. That is why I put the picture of the mountain there. So as the person is climbing the mountain, if they go above 3,000 to 4,000 meters above sea level, they develop severe hypoxia, they start coughing. Then when you do a chest x-ray, when they come down, you realize that they have patchy infiltrates. And usually in high altitude pulmonary edema, unlike neurogenic pulmonary edema, where you see the bilateral infiltrates, in high altitude pulmonary edema, you see the infiltrates more on the right side of the lung, the right lung. The capillaries become too permeable. And because of that, there's protein-rich fluid which enters the alveoli. And because of that, there's impaired alveolar fluid clearance. And there's inflammation and injury to the capillary endothelium, and that even makes things worse. This is how non-cardiogenic pulmonary edema occurs.